What do you do when the doctor is the disease? When the illness is inequality, and when the patient does not have the luxury of patience? Those are the questions that Indigenous people have been asking for many, many generations.
We want to work on reconciliation. The Truth and Reconciliation Calls to Action, the MMIWG process. We have made strides to work on those, but there is much work to do. We want to ensure that we have self-determination in education. We still don't have anywhere in this country an education system, a school, that will teach Inuktitut, our language, as the language of instruction beyond grade 4. And considering that we have one of the strongest Indigenous languages in the world, it makes no sense to me as an individual, as a parent of 2 children who I want desperately to know Inuktitut as their first language, and also as a public policy measure, why it is our human right to be educated in our language. It's our Indigenous right.
Kids apprehended at birth live 20 years less. We can't just sit back and have these kids taken away from their language and culture. We know better. And that's why we're fighting to the fundamental overhaul of this system.
We also live 10 years less than Canadians, and I don't think that's acceptable. You think about what you can do in 10 years in life, and think about that for us, our life expectancy is a full 10 years less than other Canadians. It calls for action.
Often racism is painted as ignorance. It is not. Racism is a system of knowledge. And we learn racism. We're not born racist. We become racist because we learn racism. So it's not ignorance. It's we learn it.
Any indication that you belong to a group, any little reminder, quite subtle reminder in the experiments, that you belong to a group which is usually thought of as less capable in whatever respects is being tested, affects performance.
We can lend the health voice to divestment efforts at universities and professional associations, and we need to do research into the health impacts of resource extraction on our Aboriginal communities.
The most fundamental determinants of health are these. Not many of us last very long without air, water and food.
If we are really moving towards reconciliation, we need to put our best biomedical research capabilities to work for our Aboriginal colleagues and friends.
Turning around the steamship of a very patriarchal, paternalistic, colonizing approach is going to be hard, but it's going to be worth it.
The upstream idea of how health happens is a foundation of who we are and who we think we are.
More and more organizations are seeing the capacity that exists in young communities across the country in leading these conversations.
Indigenous healing is actually decolonization.
What you do when the doctor is the disease, what you do when the illness is inequality, and what you do when the patient has no time for patience is that you tell stories.